Oh, you're very welcome. Thank you. Thank you for the kind introduction, and I want to thank Melinda for inviting me here today. She and I have worked together for a long time, and I am excited to be here. So I am going to talk today about navigating the healthcare system, and I also want to say that I think it's really, really wonderful that Pilgrim Church and the Sherborn Council on Aging have this series. I looked at some of the other presenters that you have had and will have the opportunity to hear from, and it's really hits on all the great topics and all the highlights of what it means to age successfully and age well and navigate the world. So thank you guys all for being here. I appreciate it, particularly in the rainy day. So as I was kindly introduced, my name is Anna Pollard. I am the Director of Clinical Services at LifeCare Advocates. And what LifeCare Advocates is an aging life care practice, and we're based in Newton. We cover pretty much all of Eastern Mass, into Southern New Hampshire, down on the Cape. And what we do as life care managers is really help our clients and their families navigate the healthcare system, navigate the senior elder care system, whichever word you prefer, and really help our clients and their families have a blueprint for aging well, have an opportunity to talk with and receive the knowledge of a professional, objective, experienced clinical professional. All of our care managers are social workers, nurses, occupational therapists. We had our physical therapist, but she recently retired. I'm not going to talk about life care management, but I just want to give you a little bit of a context of why I'm here and why I know what I know and how I know what I know. So I am a social worker by training. I've been at Life Care Advocates almost 19 years. I supervise all of our care managers, and before that I was a care manager. I was a care manager for, it's almost half and half. Next year it'll be half and half of my time. So this is from our Aging Life Care Association National professional organization. This month happens to be Aging Life Care Month, and our Aging Life Care Month color is this sort of spring green, so that's why I'm wearing this, and that's why my slides are green. And actually today we were supposed to wear green for ALCA month, so I'm with the theme today. So these are the 8 areas of expertise that all care managers have. We're not lawyers, we're not financial planners, but we understand how all of these 8 areas work together, intersect, don't work together, don't intersect, communicate, don't communicate, and we can really be that hub of expertise for our clients and their families as they are navigating their aging journey. And we have clients that are well and in their 50s, 60s, 70s, 80s, 90s, hundreds, aging really well, really healthy, all the way through to people who are really experiencing some very significant medical, cognitive, mental health challenges, and we're helping their families, they and their families sort of navigate what are the right choices for them, what are the pros and cons, what are the strengths and challenges of the options that are available to them. So we have one of the areas that we really delve into with our clients is really that medical navigation. So that's kind of what I'm going to focus on today. But I just want to give you a little context of who I am, where I come from, and why I can talk about this stuff with a little bit of knowledge here. Okay, so I'm going to start with the basics. I'm talking about self-advocacy, advocacy, navigating the medical care system. Some of this might be sort of what you guys do already for yourselves, which is wonderful and awesome and incredible. And sometimes it's just reinforcing that you're doing the right thing. But I'm hoping that there might be a few nuggets in here that you can take away that will help you and maybe your families if and when you need a little assistance to help navigate the system. So I'm going to start with the definition. What is the definition of self-advocacy? Self-advocacy we do in our whole lives. Speaking up for your needs, preferences, and your rights in this context, particularly in healthcare. That sounds really simple, but the system isn't really set up for people to do that. And I'll talk a little bit more about that. I will say I've experienced that professionally, helping my clients. And because I still have a couple of clients on my own. In fact, I'm taking somebody to a medical appointment this afternoon that I'm going to have to do a little advocacy for. And I've also experienced it personally with my family and with myself. The system is not set up for us to be able to speak up for ourselves when we're sitting in that exam room with our doctor. And the importance of self-advocacy, again, pretty simple but important to say. Helps ensure better care, reduces errors, and improves outcomes. Why is self-advocacy crucial? The biggest reason is that the medical system is very siloed and very complex. And what I mean by siloed is that even though we all have our medical portals now that we can sign into and send messages to our doctors, and if our doctors are all part of the same system, they can see each other's notes and all of that kind of stuff. The primary care, any specialty, any mental health, they're all sort of, any surgical intervention, everybody's sort of in their own little silo. And there's a little bit of communication back and forth. And again, it's getting a little bit better, but the system is really complex. And there isn't the amount of communication between providers that there really should be to ensure, for example, if someone's getting surgery, that the surgeon knows all of the medications they're taking and understands what their comorbidities might be, what their underlying medical conditions might be, how those might impact. And in our work as care managers, what's really siloed is what impact that siloed medical system has on what happens when someone goes home from a medical appointment, is discharged from the hospital after surgery. The assumption is that it's just gonna magically work out somehow. Or maybe somebody gets some VNA, visiting nurse coming in a few times a week, or a physical therapist coming in a few times a week. And that's really where we see as care managers the big breakdown happening. So we'll talk a little bit more in a few minutes about communication with providers. But that's what I mean by sort of siloed and complex. Time-limited interactions. We all know that we wait in the waiting room like 50 bazillion times longer than we actually get to see our doctor. And in those 15 minutes, it's a 15 minutes, maybe a half an hour if it's your annual review. There's a lot, they're sort of slapping on the blood pressure cuff and taking your temperature and all that kind of stuff. And yep, you're, examine, yep, you're good, okay. And you're like, wait, I have questions about my health. And the time is not really built in to have those conversations. Primary care physicians in particular, but everybody, every provider has really large caseloads. Primary care physicians have thousands and thousands of patients, thousands on their caseload. And they're supposed to only see them for 15 minutes so that they can see the maximum number a day. So that's why it can feel very, very rushed. And also, hopefully they have support people like nurse practitioners and physician's assistants and those kinds of things to help with the things that the physicians themselves don't really have to. Or maybe you have a sick call to your doctor and you see the nurse practitioner who is equally as qualified to help out. But they're dealing with huge caseloads of patients. There's a lot of implicit bias in the healthcare system, and again, that's another reason to to advocate for yourself. There is age bias, there is sex and gender bias, there is cultural bias, there is language bias, and because of all of the other things, physicians aren't taking the time to think about the person that's in front of them. They sort of see the person as the aggregate of the diagnoses that are on the computer, that they're also typing while they're talking to you, right? Which annoys the heck out of me. So there's a lot of implicit bias, so it's very important. Unfortunately, it's important for us to take, and I put myself in these shoes too, for us to speak up for ourselves when we need help or when we have questions. And safety concerns. If somebody doesn't feel like they can ask a question about a medication or a concern about a medication, or they don't understand how they're supposed to take the medication, or they don't understand whether or not it interacts with another medication that they're taking, or they have questions about a procedure, or they have questions about a blood test result, and it can get lost. We hope it doesn't, but those things can get lost, and there can be safety consequences. And again, we kind of hope that our doctors are paying attention to all of our medications and are asking us about what kind of vitamins and supplements and those kinds of things that we might be taking, but they don't always. And so there's a lot that's put on the patient to speak up and speak out for themselves in an environment where that shouldn't be the case, in my opinion. Here are some of the common barriers to self-advocacy. Here are all the things that you or someone you love might feel when they're in an environment that they are advocating for themselves. First of all, there's the fear of being dismissed. Oh, don't worry about it, everything's fine. Why, I don't have, the doctors aren't gonna say, hopefully, I don't have time to answer that question, but don't worry about it, everything's fine. Yep, we're, no worries, everything's fine. This is a really routine procedure. This is an outpatient surgery. That medication doesn't have any side effects, that sort of brushing off, regardless of why they're brushing you off. Some of that might be that implicit bias. Lack of medical knowledge. You and I are not doctors. So a lot of that sort of jargon that they talk about, you think you understand it in the moment, and then you leave and you say, oh gosh, I don't understand what's happening with my medical care. So just the natural instinct of the doctor to use the medical jargon and not sort of put it in lay terms. Language or cultural differences, this is really huge. If there's a language barrier, the communication isn't happening properly. If there isn't an understanding of the patient's cultural background and cultural norms and cultural beliefs, there could be an error that maybe that person doesn't want to take that medication for whatever reason, and it really affects their ability to be taken care of well, and the doctor's not paying attention to that. Anxiety and stress during appointments. White coat syndrome is a real thing. It's when your sort of blood pressure goes up and the doctor takes your blood pressure and they're like, we're gonna come back in a few minutes and why don't you take a few deep breaths and we'll take your blood pressure again. And they're like, oh my God, it's really high. So that, and just that anxiety of being in the doctor's office, sitting on the table with the paper gown on, feeling very vulnerable. We're going to talk about advocating for yourself later, but okay, great. I had all my questions written down, but they're over there on the table, on the chair where all my clothes are, and I don't really feel safe getting up and walking over there right now. So just that anxiety, and you're at the doctor. Who wants to be at the doctor? Even it's for your annual, and especially if there's something going on, you're sort of feeling that anxiety about there might be something wrong with me, and that really clouds people's judgment and ability to remember, and ability to attend, and ability to process information. It's absolutely a real thing and should absolutely not be underestimated. I've had that experience myself where I've been in a circumstance and I say, I probably should have handled this better. I probably should practice what I preach. And then power dynamics with providers. less, it's sort of equaling out a little bit, but just the feeling that my doctor's my doctor. I should do what my doctor says. I shouldn't be questioning my doctor. My doctor should know all of this. I should not have to question. He or she, knows everything. They know what's best for me. Yes, of course, they've been to medical school. They sort of know, I'll admit they know more than I do. But it's your health. And so if you have questions, ask them. That's kind of what one of my takeaways is. Yes?
One thing I think would be added to this, I have a memory problem.
Yeah.
And so when I talk to the doctor, he'll ask a question, I really can't answer it.
Yes. Yes.
Or if I have to ask a question, I can't think of the facts.
Yep.
I have to include.
Mm-hmm. Mm-hmm.
And I don't know if if I'm lucky, my wife will come and she'll interpret for me.
Yep. Yep. Absolutely.
But I think that's a major barrier.
Yes. You are absolutely right. You are absolutely right. And I didn't get too much into, this is sort of a little bit more general, but definitely anyone who has a memory problem, either mild or otherwise, has sort of that added challenge, and that is definitely not taken into account in these types of interactions. So I think you mentioned a couple of coping mechanisms for that I'll talk about in a little bit. I'm glad to hear that you can have somebody go with you. But yeah, it's very important to even disclose that to your doctor and just say, you know what, can I have just a minute? I need to collect myself, or I'm sorry, I don't really know the answer to that question or can't recall. It's okay. It's okay to say that. But thank you for bringing that up. Absolutely. Yes.
You mentioned anxiety or stress during appointments, and if you can't think what you wanted to ask, if you write down your questions.
Absolutely. Absolutely. You just skipped ahead a couple of slides. Yes. Absolutely. Absolutely. Yep. That is a big thing. So also knowing your rights as a patient, this isn't something that's talked about a whole lot. Like they might, it's one of those papers that they have you sign on your portal when you're registering for your appointment, or one that they sort of shove at you like, oh, you're here, sign this. People don't really read it, and also it's good that they have you sign it, but people don't always take advantage of the fact that you absolutely can give or not give informed consent for any kind of procedure. You can say no. No, I don't want to take that medication. Is there something else I could do? In fact, my mom did that. She had high cholesterol, and she did not want to take a high cholesterol medication. I mean, it's kind of mild as medications go. She said, no, I don't want to take a medication. What else is there that I can do? And the doctor said, well, you can change your diet and exercise more. So she changed her diet and exercised more and got her cholesterol down, didn't have to take the pill. So, and people have, you can say no, and you have the right to ask questions. You have the right to understand what's happening to you and for you and with you. You have a right to a second opinion. The physicians often sort of poo-poo this. Oh, no, you don't need to do that. You don't need to do that. You don't need to, but you have every right to get a second opinion. It's covered by insurance. It's all good. And if you need just somebody else to take a look at you and take a look at your records and say, yes, this procedure or medication or whatever is appropriate, or no, it's not, it is absolutely within your rights to ask for that. You have a right to access your medical records. Again, the portals are very helpful. Those are like the best invention ever. Portals are very helpful because you have access to all of your medical records on the portal, but you also have the right to ask for a copy of your medical records. You write to or put in a request, usually through the portal or at your provider's medical records, and get a copy of them and review them and make sure everything's right. It's, sometimes there's stuff on there that's not right, and it takes a long time to get it corrected. You have the right to refuse treatment. You can say no. And you have a right to privacy. There's a very, very strong healthcare privacy act in the United States that protects your privacy. You can give people permission to access your medical records, and I'll talk a little bit about that in a few minutes, but you do have the right to privacy in your medical records. So those are some of the rights. So this gets to your question about sort of memory issues or the anxiety around that. These are things that we tell our patients, our clients to do all the time, and these are things actually that I have started to do. That's sort of how I know that, you know, when you're sitting on the table and your questions are over there, you're like, well, shoot, now I gotta get down, I gotta go over there, get back up. But I have my questions that I can ask. Keep a healthcare journal. If you have stuff happening, keep track of your blood pressure, keep track of, and you know, your pain, keep track of your fatigue, keep track of your food intake, you know, whatever it is that you should be taking care of, because it's hard to remember what you do on a day-to-day basis because it's so routine. Regardless of whether you have a cognitive issue or not. So it's really just a nice record to have to go to the doctor, particularly if you need to be tracking something. My father-in-law, and patients, but my father-in-law had an illness and we really needed to track his blood pressure and his pulse, his pulse and his weight. So my mother-in-law and I sort of put together this chart that she would fill out every day, and then I'd take him to his appointment and we'd have the chart. So we didn't have to remember, like, oh yeah, it's been pretty good, we think. It's like, nope, here you go, here are the numbers. And that way his medications were able to be appropriately managed. Bring a support person. I should have crossed out if needed. Just bring somebody with you. It's really important because it sort of gets to that anxiety and it gets to the cognitive stuff, and it just gets to really the crux of it. If there's anything I want you to take away from here, there's like two things. This is one of them. Bring somebody with you. If you're well and you're healthy and it's a routine annual appointment, maybe you don't need to take somebody with you. But if you're talking about a change in your medical status, if you're talking about a medication change, if you're talking about a procedure, if you're talking about anything of significance, please bring somebody with you. Have it be somebody that you trust. Have it be somebody that you interact well with, and have it be somebody who can sort of step in for you and with you. If you are sort of coping or managing the emotions of being told that you have a diagnosis or that you need another this is a person who has a little bit more objectivity. Of course, if it's a family member who loves you, they're also going to be, they're also going to have some emotional reaction, but they're going to have a little bit more objectivity. Maybe you talk about talking about research conditions. Maybe you talk a little bit, maybe you do a little research beforehand about what it is that the doctor is going to be talking about if you know that ahead of time, so that you know what questions to ask. You write down key questions and write them in a way that's accessible to you. If you need to bring a notebook and a pen, bring a notebook and a pen to your doctor's appointment. It's okay. And say, I need to ask some questions. Question 1, and then answer. Write down the answer, so that you can process it later and think about it and ask more questions and that kind of thing. So that is really bringing somebody with you, and writing down key questions is really important. And again, personal and professional experience with this. I had a couple of things happen personally that, again, I wish I had followed my own advice. Oh no, I do this for a living, everything's really fine. No, it's not. Because it's me. It's not one of my clients. I'm not the objective person here. And then organizing relevant documents if you're going for a procedure and there's test results or imaging or specialist notes. This would probably apply more in the if you're getting a second opinion and maybe that doctor's not part of the same system that your regular doctors are a part of. Just organizing anything relevant that's important. Again, sort of in the age of having things available on the portal, it's sort of less. You don't need to do that quite as much, but definitely bring somebody with you. Do a little research. and bring somebody with you and write down your questions. Yes.
Could you talk a little bit more about the research? Because I'm finding that, I say I go to WebMD.
Yeah.
I don't know what I go to.
Right.
I know if it says Mayo Clinic, that I can pay attention to
Yes.
it. But I've learned more from that.
Mm-hmm.
You know, trying to figure out what's happening to me. Do you have a website that you recommend?
So I don't have a particular website.
Yeah.
I would say that if you do Google something, sort of take the results. I very much appreciate that you identified the Mayo Clinic. I think if you Google a procedure or a diagnosis or a medication or something, really pay attention to the sources of the information that you're getting. You know, WebMD is a little bit of a kind of an aggregate of things, but I would trust something from the Mayo Clinic or from Mass General or Johns Hopkins or Sloan Kettering or those kinds of hospitals, or if there's a research about it that's readable by the layperson, that those are all good. So I think researching from quality sources is good. The other thing that started to happen with our clients and their families, which is kind of cool, but again, sort of the same caveat, is that they're taking information that they're getting from their portal and they're copying and pasting it into ChatGPT and asking ChatGPT, which is kind of like a Google, but a little more directive, to sort of interpret it for them. And they're actually getting fairly good information. Again, like anything on the internet, you need to take it with a bit of a grain of salt. But we have in fact, I was talking about this with one of my care managers, because the daughter called her and was like, so I put my dad's stuff into ChatGPT and this is what I found out and this is what I want to ask. And we're like, go, I love it. So, so using that technology it's a tool. That would be my my word for it. Yes.
I found that when the report comes into the portal,
Yeah.
before I see the doctor for the results.
Yes.
So I go in and look at those reports. There's many, many words I do not know.
Yes.
And I tend to look up then those terms.
Beautiful.
So that I can be halfway intelligent when I go to that next appointment. And I found that really helpful.
Yeah.
Even those medical terms.
Yes, yes. Yeah, absolutely. I think that is also a trend that we're seeing, is that people are able to, because they're getting the report even before their doctor sees it sometimes, that you're able to look up those terms. It sort of harks back to the previous slide about medical knowledge. Maybe you're not a doctor, but you can look up the terms and understand what it means. And absolutely, that's great. I'm really glad to hear that you do that, because then you can come to that appointment, writing down your questions and saying like, hey, when I look this up, this is what it means.
Or I still don't understand it.
Yeah, or I still do. That is also, yes, possible. Yes, I got 2 questions. You first.
One thing that, my mother lived in Dallas,
Mm-hmm.
and so I couldn't go to her appointment.
Yeah.
with her, but she would just ask the doctor, is it okay if I
Yep.
call my daughter and
Yes.
have her attend
Yep.
by phone? And
Yep.
we found that actually worked pretty well.
Yep, it does work very well. Yep, phone or FaceTime or something like that, if that's a thing. Yes, absolutely. In fact, sometimes our families will do that for our clients, and sometimes the care manager will, even if they've got something, if they've got another client, but they know they need to be in this important appointment, they'll call in. So yeah, technology's really made it good. Yeah.
Just to follow up on your comment about why it's also important to take somebody to an appointment. One thing that I've observed over time, and I kind of have a medical background, is that when I'm alone, and it also depends on the doctor's personality and style and how pressured they are. However, they take you much more seriously when you have somebody with you. Whether or not it's a secondary
Yes.
legal issue, I don't know, because they're basically a witness to what the interaction is. But saying that, following up on what Lois said here about looking at your record, I had a situation where, and this was a Mass General doctor too, where somebody went with me to this appointment, and I don't always read, I look at the test results like she does right away, but oftentimes I don't read their notes or reviews, like I've had it after the appointment. You know,
Yeah.
after the appointment. I say, I'll write the note, no big deal. Well, after this particular appointment, I wasn't too happy kind of with the response, and so I read the note, and it was actually inaccurate. And so I wrote him a note back immediately, kind of countering this. And I honestly do believe that if I had not had somebody with me, he would not have responded. He immediately said, oh, you know what, you're right. X, Y, and Z, I'll correct that note immediately. But it's important to not just look at the test, it's important to really look at their notes.
Yes, yes.
Because sometimes they're not accurate.
Yes, yep.
And other physicians are then reading them, and that's what I put in the notes.
Yes.
I said, I believe in medical consistency, and this is inaccurate.
Yes.
And blank.
Yes.
So it's really important to read those.
Yes, I totally agree. Absolutely, absolutely. Go ahead.
To your last point,
Yep.
every time I go for any procedure, I take my healthcare proxy.
Yes, we're going to talk about
The Mass
that.
General
Yep.
portal always seems mystified that
Yes.
I have one of these, even though it's been uploaded.
It's so frustrating.
But I always take it because.
Yes, good. I am really glad to hear that. We're going to talk about healthcare proxy. Let me make sure I'm not going too over time here. Thank you all. This is all really good. I love the conversation. And to your point about inaccuracies in the medical record, I have a client right now. It's kind of resolved, but she is applying for a continuing care retirement community, and she's completely independent. And there's a lot of criteria to sort of enter into the CCRC at the independent level, and there is a significant error in one of the notes and one of the diagnoses that she has that was actually preventing her from being able to be accepted into the CCRC. And she had to, and it was from years ago that she didn't notice because it was before portals. And then she found out about it, and we have resolved it, but she and I worked together to get that rectified, so that then she could sort of move forward, because otherwise she was perfectly qualified. And actually she's moving next month, so I'm happy for her. But it was a lot of work.
Can you tell us what the specific shortcoming might have been?
It was an inaccurate diagnosis. We never figured out why it happened. Whether it was like somebody else that the doctor was thinking about. It was sort of I don't want to go into details, but it was something that it was an elevation of something she did have. Like she kind of had this level of condition. And when it was documented, it was documented as this level of it was like I guess a good equivalent would be like something precancerous but benign, and having it documented as a cancer diagnosis. Like, I guess that's as close as I can get to what. So that's like the wording is important, particularly if and it's also, which I'll talk about in a little bit, it's also important for that accuracy for when and if people are looking at supportive living environments, and you don't want an error in your medical record to prevent you from being accepted into a place that you need to, or a service that you need. So thank you, everybody. This is wonderful. Wonderful feedback. So communication strategies. I'm not sure I need to really belabor this, given this group, but be clear and direct. Use I statements. I'm concerned about. That's sort of like that power dynamic. You're sort of taking some of that power back to yourself. Ask for clarification. Can you explain that to me in a different way? Or what I heard you say was XYZ, and maybe you're taking notes and you say, what I heard you say was, read your notes. And then the doctor can say, no, that's not what I said, or yes, that's what I said, or that's kind of what I said. And again, this is really, the I statements is really sort of stepping into that space and saying, I know that my appointment's only scheduled for 15 minutes, But if we need to take 20 or 25 so that I understand what's happening, or half an hour or whatever, that I understand what's happening with my health, I'm taking that. You can deal with the rest of your caseload later, I am taking this time so that I can understand what's happening with myself. And then again, repeating back key points. What I heard you say was, I am concerned about. So just being really, really sort of taking the power in that interaction. Okay, so we've talked about some of this already, but some tools for self-advocacy or tools for advocacy. Patient portals we've talked about, mobile health apps, that might be a way that you're recording, how many steps you're taking and what your blood pressure is and what your heart rate is and what your blood sugar is, or whatever it is that you need to monitor, so that it's all in one space. It's sort of able to be aggregated. You can, email it to your provider. You can post it on your portal. You can bring it with you. Medication tracking tools, same thing. Talking about maybe you have a little medication box or something, but you're able to have a list of your medications and how often you're supposed to be taking it. You might be able to list, if it's a new medication, you want to talk about what side effects you might be feeling from that, or whether it's helping or not, because polypharmacy is a huge issue. You take one medication and then you have the side effect, and you take another medication for the side effect, and then you take another medication for the side effect of that medication. It's just ridiculous. So some of the conversation around that is, do I really need to take this medication for my health? And if the answer is yes, the answer is yes. I mean, you don't want to maybe go without your insulin or glipizide or something, but if it's something else that you could do with a lifestyle change, or isn't really something that's bothering you, but the doctor wants to feel like, that's the other thing, doctors want to feel like they're doing something. So like, oh yeah, sure, here, take this medication, no problem. And it adds to, it just compounds itself over time. Support groups are advocacy networks. These are a really nice tool for people with specific diagnoses like Parkinson's disease, multiple sclerosis, Alzheimer's or dementia, those kinds of things. There are lots of them on Facebook and those kinds of things. Again, it's sort of like using Google or using ChatGPT. Like, you take it all with a grain of salt, because people are very subjective. That's very subjective information that you are getting in those groups. I do a couple of support groups. I do one for caregivers for people with Alzheimer's, and then I do one for people with Parkinson's. And there's a lot, it's all good information, and it's wonderful, and I'm so glad that they're all sort of talking amongst themselves, but again, it has to be taken within the context of your own individual circumstance. But the support and the information and the resources can really expand your horizons in terms of what can be done. And then health literacy resources, sort of the research and, library. I mean, there's still a library. You can still go to the library and have the research librarian help you find a book on whatever, and just sort of that research for yourself. Yes, go ahead.
I'm not sure I even have this right. ChatGPT?
ChatGPT, yep.
Oh,
GPT, yep.
I've not ever heard of it.
Mm-hmm.
Can you say
Yeah,
more
it's kind
about
of,
it?
I'm not a tech person, but but I play one on TV. It's sort of an artificial intelligence kind of a thing. So like, you can put in, I don't know, give me the 10. You can put in anything. It's kind of like doing a Google search, but it doesn't come up with a bunch of web pages. It comes up with kind of a summary information.
Like you Google ChatGPT,
Yep.
and then you have the page.
Yeah, and then you'll have the page, and
okay.
I happen to have an account because I actually use it for my emails sometimes. If I'm not, like, I gotta just say, I want to say this, but I want to say it that way. So I put it in, I say, ChatGPT, tell me how to say this way. And it'll come out with something that's pretty good. And then when it comes out with the same thing, I'm like, oh, I was on. So it's very universal. It's one of those things, it's sort of, I have kids in school, my daughter's a senior in high school, and it's like, do not use ChatGPT to write your papers,
Right.
but it's a good tool to get information that's sort of aggregated from everything that is on the web. So you're not clicking on all those like Mayo Clinic, et cetera, web pages. It's all sort of in one digestible form, is probably the best way to say it. Yes, sorry.
Did you say anything about doing some research so that you end up doing self-diagnosis that leads in wrong direction?
Yeah, don't do that.
I guess I see a concern here.
Yes.
Especially if you're looking at ChatGPT.
Yeah, absolutely.
Things like that,
Yeah.
that it can
So-
give you misinformation.
Yeah,
that
yeah,
can
yeah.
be-
Absolutely. So, yeah, so that's absolutely true. So I think you want to use these tools as tools. You want to get the definition of a term that you don't understand. You want to get maybe some of the general information about what a medication side effects might be, or what a procedure's recovery time might be. But all of that information, 100%, should be digested and presented and understood in the context of your own individual circumstance, your own, your makeup and your health and what medications you're already taking and all of that. They're tools for information, not to say this is what I have. These are my symptoms, so this is what I have. It's, hey, I got this test result. I don't know what this word means. So I'm gonna Google it or ChatGPT it so that when I talk to my doctor about it, I know what they're talking about, because they're gonna be using that word that I don't know. So yes, you're absolutely right that this isn't self-diagnosis, this is information. Yes?
So it pulls information from the internet.
Yes.
Like you said, it
Yes.
kind of summarizes it.
Yes.
If there's wrong information on the internet,
Right.
that's still in
That's
there.
in there, yes, yeah.
So you
yeah.
really have to be careful.
Yep. Mhm.
But you can tell things like, I was an English teacher, so
Yep.
you can tell, write a story about frogs that are rainbow colored and eat people. And it will create a story for you.
Yes.
So it's a very interesting technology, but you gotta be really careful.
You do have to be careful. Again, it's a tool, it's information, it shouldn't be diagnosis or absolute or anything. It should absolutely be taken in context of getting information for yourself and then talking with your physicians about that. They do go to medical school for a reason, so. Yes?
Does the site charge you for that?
Nope, it's free, at least for now.
It becomes popular.
Yeah, right, exactly. Sorry, I'm getting a little cynical. Okay, so I have a couple more slides. So now we get to my favorite part. And I think you guys are going to be talking with an elder law attorney maybe next. So he's probably going to be delving into this a little bit more. But it is something that is really, really important to me in my personal and professional life, something that I've seen work, something I've seen when it's not there really not work. And that is advanced care planning. It is really, so I took this slide from Honoring Choices, Massachusetts, which is a wonderful organization. I highly recommend, if you don't already have your healthcare proxy, power of attorney, personal directive, medical orders for life-sustaining treatment, comfort care, please go to Honoring Choices. There are other websites. The Conversation Project is one, but Honoring Choices is my favorite. And I also happen to know the lady who started it, Ellen DePella. Yes?
What would you say, honor?
It's Honoring Choices.
Honoring choice.
Yep. Yeah, I think it's honoringchoicesma.org, I think. So it is super duper duper important. I think you talked about the healthcare proxy. So so does everyone know what a healthcare proxy is? I don't want to go into it if nobody, is there anybody that doesn't know what a healthcare proxy is? Okay, good. Oh, I love that answer. Okay. And is there anybody who does not know what a durable power of attorney is? Excellent. Very up-to-date crowd. I love it. Anybody who doesn't know what a personal directive is? Okay. Okay. Awesome. Okay, so I won't go into what healthcare proxy and power of attorney are because sounds like everybody knows. It is super important that you have one. It is actually really important to have one. This is a little nugget of information that you can carry to your families. After a person turns 18, their parents are no longer able to access their medical records. They're not getting a call from the doctor if their child is sick, etc. So if you have whoever in your family that might be close to turning 18, please encourage them to sign a healthcare proxy, because if something happens to them, the decisions about their medical care would go to the state. My son is almost 21, so I had him sign one. My daughter's going to sign one in 2 months when she turns 18. I actually didn't really know that, and Ellen DePaula taught me that. It is also really important for anyone. I have one, my husband has one, everybody should have one. And you are absolutely right that no matter how many times we have our providers put our healthcare proxy in our medical record, it's not there. It's not there, it's not there, or it's not accessible, or whatever. So please do bring a copy with you. Whenever you have a procedure that, particularly if it's a procedure that you're gonna have anesthesia for, please bring it with you and make sure that it is physically available. Make sure that you have a copy, make sure that the people who are named as your healthcare proxies have a copy, make sure that they know that they've been named your healthcare proxy, and as much as possible, do make sure it's in your medical record. Power of attorney, please make sure that, again, the people that are named your power of attorney have a copy of it. Make sure that all of your financial institutions have a copy of that. Don't just put it away in a drawer and say, okay, I checked that box, it's all done. Make sure that the people that need it have it. So, and the personal directive is really, it's much more of a, in my opinion, it's more of a conversation than it is a static document. It is more of a conversation than a static document. And this is where you express what your wishes are for your care. And this is maybe what your healthcare practice is, what your healthcare proxy should be following. It is an ongoing conversation, and I won't repeat myself too much, but it is an ongoing conversation because your health now, hopefully it's your health the rest of your life, that would be wonderful. But most likely your health is kind of going to go like this, or maybe go like that. And your choices, your decisions, your thoughts, your plans, your wishes might change over time. So what your wishes are right now, in terms of your care, might not be your wishes, 2 years from now if something happens. Or they might stay the same. So again, ongoing conversation, living document, very important, really hard conversation to have with your healthcare proxies, family, and your family. Whoever it is that's in your life, who's going to be supporting you. But it's a really important conversation to have. And it really gives people a lot of peace to understand what their loved one wants in terms of care or doesn't want. So that is one of my other takeaways. It's like ask questions and write things down at your doctor's appointment and have the conversation with the people who would be making decisions for you about what you want, and not have that be a static conversation. Yes?
You said something a moment ago that maybe I didn't hear you correctly.
That's okay.
About durable power of attorney.
Yes.
When you made a comment that you should have all your financial institutions have a copy of that.
Yep.
I've never heard that, A, before, but B, if you have direct beneficiaries on financial documents in these organizations, I don't see that there would be a need for a power of attorney.
Mm-hmm.
Is that correct?
I'm not a financial person, but my understanding is that even if you have a direct beneficiary, that you do want to have your financial institutions. Okay, so here's the answer. Sorry, I had to process that for a minute. The other point that I didn't make is that this isn't just about death or end of life. This is about what if something happens. So your durable power of attorney, I mean, I hope none of you ever have to do this, but your durable power of attorney could be in effect because you are not able to make your own financial decisions. It's not just about, and actually the durable power of attorney is not in effect when you die. The other thing you should have is an executor of your estate, because that person is the person who would manage things after you die. If your durable power of attorney is while you're living, and if you are not able to make your financial decisions. So it could be, I don't know, whatever, an IRA or something that has beneficiaries. The durable power of attorney is for someone to be able to manage those funds if something happens to you that you are not able to do that and you need somebody to be, paying your bills for you and that kind of thing. So that's the answer. Sorry, it took me a little bit to get there. But also have an executor of your will.
Right, but I guess what I'm a little confused about, I mean, some people may only have one item, but some people may have 20 items.
Yep.
So I guess where my mind is going is if somebody knows that they're the durable power of attorney and they have that document and you have it with your legal things, why would, let's just say 20 items, okay, why would all 20 of those institutions have to have it if they could prove that issue?
Yeah, good question. And I would say, ask the elder law attorney that. I think he's coming, is it next week or week after? Financial person, sorry, yeah. But we work with a lot of elder law attorneys, and their advice is to make sure it's on file, because if something happens to you and your son, whatever, son, daughter, whoever, goes to the bank and says, hey, my mom's sick, here's my durable power of attorney, they're gonna be like, really? You sure about that? So it's with good reason. They're protecting your finances. They don't want to just give your money to anybody. If you do it ahead of time and it's there and it's you giving it to them and saying, this is my durable power of attorney, these are the people that can make decisions, maybe there's some extra thing that you need to do for that particular institution to authorize, et cetera, et cetera. So it can be very cumbersome, I agree, if you have multiple financial institutions that you're dealing with, but it's going to save your power of attorney a lot of work and a lot of trouble if you're the one who's giving it, rather than them saying, I'm the durable power of attorney and I get to control the money now. Being a little bit facetious and simplistic about that, but yeah, thank you for the question, though. I appreciate it. It's good to process through all this stuff, for sure. I've lots of stories I could tell. And then if and when people are, a little bit have a little bit more going on medically or cognitively and/or mental health wise, then you want to get into medical orders for life-sustaining treatment, or MOLST. That is a form actually that's available online, and your physicians, if someone is in the position to need it, that should be a conversation that you're having with your physician. Talks about what kinds of life-sustaining treatment you do or do not want to have, and under what circumstances you would want to have it. So it's a little more detailed than the personal directive. It's a little more detailed than the power of attorney, than the healthcare proxy, and it's a medical order. You and the doctor, or your proxy and the doctor, sign it, and then comfort care and DNR closer to the end of life if needed. So just wanted to, this is an important part of that advocacy, because you can do your own advocacy until you can't. And you could do it, so you might have surgery and you're under anesthesia and something happens and the doctor needs to make a decision, and they need to have somebody that they can talk to make that decision. All right. Come on. There we go. So we kind of talked about this a little bit, but I'll finish it up. Healthcare proxy in your medical record with you and with the people or person named. Your personal directive should also be communicated to your providers and your proxies. And it is an ongoing conversation as your health changes, which is important. Yes?
Do you have to, does everybody have to have the pink slip, or can you give them Xerox copies?
You can give Xerox copies. I believe the most does not need to be an original document.
Okay.
Yes. And it should also be in your medical record for what that's worth. Okay. That is it for me for now. Yes, Melinda.
Anna, can you just touch on a situation where I think people run into if they're at a hospital and the social worker says, we're going to discharge you. I feel like more cases than not, people feel very rushed. Like,
Oh, yeah.
how on earth could you discharge me when, I'm not walking independently or I live home alone? How much pressure are you really under? Is it perceived pressure? Is it real pressure? And can agencies like Kepro buy you time, or is that not a good way to buy time? Did you touch on that?
Yeah.
Sorry.
No, that's okay. I'll be here for hours, Melinda. No, it's so.
You might have to repeat the question for the camera.
Yeah, no, that's okay. So the question was about if you're in the hospital and the social worker or case manager comes to you and says, "Okay, time to go. See you later." How much pressure are you under? What does that mean? What do you have? What are your rights around that? So first of all of that communication stuff that I talked about, ask questions, write them down, have somebody with you, sort of be educated, even more important in the hospital because you're probably recovering from something bad that happened to you. And you're sort of not in the headspace to necessarily be a great advocate for yourself. You're maybe coming out of anesthesia or in pain or whatever. So there is some pushback. I think there is some ability to push back. I think that, if you're not able to, and that's sort of what I had started out with in terms of the silos, like the silo of the care outside the hospital or outside the procedure room isn't sort of taken into consideration. The assumption is that you have somebody who can take care of you. And if that's not the case, unsafe discharge is a buzzword that we that we use. Like, this is an unsafe discharge and this is why. Because they don't have a support system at home, or because they're not able to walk independently, or they might be able to walk independently with a walker, but they have stairs to go in their house. What are the options? The options might be skilled nursing rehab, or respite, if somebody can, if it's financially feasible, respite stay in an assisted living, staying with a family member, having a family member come stay with you. So there is some room for pushback. A lot of that is really dictated by insurance. So it's really the hospital reacting to what they know the parameters are of what the restrictions of the insurance company are on what they will and will not pay for. And they don't want to be audited by the insurance company and have you stay have stayed a day longer than was medically necessary, but they also don't want you to come back before 30 days because then that gets flagged for the insurance company too. So yes is the short answer, is that there is room for advocacy there, absolutely. And as I said, sort of even more important to have somebody with you, family member, patient advocate. Some hospitals, or there are some patient advocates who are private and who really just focus on the medical care. Care managers can 100% do that, but we're looking at things from a little bit more of a holistic kind of view, and we're looking at things from a little bit more holistic point of view. So the ombudsman, all the hospitals have ombudsmen that you can ask to speak with if you're concerned about your about your discharge plan from the hospital. So there are some resources you can appeal the discharge as well. So that's particularly if people are on Medicare, there's actually a very clear sort of appeal process that might buy you a little bit of time. And certainly if we, just from the care manager point of view, if we get a call from a family member that says my loved one is in the hospital and they're about to be discharged and I don't, I think it's unsafe and all of that, what we will say is appeal it, say it's unsafe, and let them know that you've hired a care manager and that we need time to do our assessment and help make sure that it's a safe discharge. So.
Thank you, that's helpful.
Yeah, you're very welcome. You're very welcome. Yes?
Who's responsible for getting a second opinion?
The patient. Mm-hmm.
So you have to find somebody.
Mm-hmm. You could ask, your doctor's not necessarily, nothing's absolute, but your doctor's not necessarily going to say, hey, you should get a second opinion. Maybe they will. You can ask your doctor, if I were to get a second opinion, is there somebody that you could recommend? But that's something that's initiated, that would be initiated by the patient or their family. Yeah, right. It's, sort of defeats the purpose to have the doctor recommend. But it's a resource. It's not an absolute. If you trust it's sort of like if you trust your doctor, but you just want to make sure that, that it's the right thing. Maybe you do ask them for a second opinion or, do a search on the hospital website or go to a different hospital group or something. If you're part of MGB, Mass General Brigham, maybe you go to B.I. Leahy or something, or UMass Memorial, or wherever. So, thank you all for your questions. I appreciate it. Good. All right. Thank you. Thank you for having me. I appreciate it.
We have a lot of snacks left, so please, on your way out.